Let's bring in Florida Republican Congressman Ted Yoho. Congressman, thanks for your time, sir. You have been opposed to this health care plan from the beginning, as I understand it. If there was a vote today, the plan as it stands, would it pass the House?
I can't speak for the House. I would not support it in its present form today, but we're working in the right direction, so I look forward to working with our leadership to refine some things in this program.
The CBO report that came out, did it in any way, shape, or form change your position on the bill?
No, not at all. I mean, the CBO, if you look historically, they've been way off on certain things. If you look at the original cost of the Affordable Care Act, it was $860 billion. But truth be known, it was over $2 trillion. It's only off by a factor of $2 trillion. So the CBO is a good starting point, but it's not the end result. And so I think we need to just look down the road of what we're actually trying to accomplish here. We know the Affordable Care Act on its own, left alone, is going to fall on its own demise, and people are going to be left without insurance. We're seeing health insurance companies vacate the market. We see the exchanges. Some counties only have one insurance marketer, and so on its own, it's not providing the health care that it was supposed to provide. And the majority of the people that went into the Affordable Care Act were on Medicaid. And Medicaid, if you look at it on an industrialized world platform, has the lowest health care response or outcomes anywhere in the world. So we really don't want access without quality. I think more importantly, we want to focus on quality care for everybody.
So
and that's what our bill will do.
It sounds like, Congressman, that you are okay with sacrificing some coverage for access.
Well, I think the bottom line is you want quality care, and that's what we're focusing on. We want quality care for people. You can have access all day. If it's not good care, what good is it?
What good is the care if you don't have the coverage?
Well, again, our goal is to make sure people have access to coverage, quality care, and that they can afford it. The way we're going, I'm one of the people that lost health care because of the Affordable Care Act. My premiums went up. We're paying over $10,000 more than I used to pay. And so I'm one of the people that got affected by it severely. And it's non-sustainable. And if I can't afford that, nobody, people in a lower income bracket from what a congressman makes, which is $174,000 a year, how are they going to afford this for their family?
But we know for a fact that there have been millions of people who have been able to afford health care under Obamacare, as it's called. Isn't that correct?
Well, that's debatable if you look at where these people came from. How many people got displaced out of the private market sector through their employers that were providing insurance, but because of the Affordable Care Act, they lost that? Or how many people got laid off because of the Affordable Care Act, and they moved people from a 40-hour work week being full-time, which was historically, but because of the Affordable Care Act, they moved to 30 and they got laid off. And then they moved into the Medicaid exchanges. So we went from people being covered through their employer to a government-run program with subsidies. And we can't afford this as a nation. And I think we all need to take a step back and look at where we're going to be 5 to 6 years from now.
Sure.
All you have to do is look at Puerto Rico. That's where we're heading. And so we can put a program in, but if we don't pay attention to the bottom line, we're going to lose all this.
Well, you would also acknowledge, though, that even if folks aren't covered, even if you've increased access in some places and decreased it in others, when people get sick, they're going to go to the hospital. People aren't just going to the cost of people using hospitals as primary care physicians, we know that is exponentially more expensive than giving folks access on the front end. This is a question that I've really, and I think it all really sort of boils down to just this one question. Healthcare in the United States of America, should it be a privilege or should it be a right?
Man, I can't tell you how much I appreciate you asking that question, because that was the very thing I heard President-elect Obama say in an interview, and that's what got me to run. I don't think it's a right that the government should provide to the individual. That wasn't the question, though. That wasn't the question. The question wasn't who should provide it. The question was... I'm going to answer that.
Okay.
Is it a privilege or a right? It's a right that people have access to quality care. I don't think it's a right that the government should provide health care for all people. This is a fundamental divide of our country. And it goes back to Woodrow Wilson's essay, Democracy versus Socialism, from 1887. In that, he said that the role of the federal government is to provide for the needs and the wants of society, that the government can provide and perform better than the individual, and that the individual rights come secondary to the needs of society. That's an underlying fundamental difference of 180 degrees of what a constitutional republic stands for. And so I am 100% opposed to that. I think everybody should have access to health care, and I think the government should make sure that it's played properly. And I think we need to look at the drug companies and the insurance companies. If you look at the EpiPen costs roughly $600. I can buy a bottle of EpiPen as a veterinarian. Yeah. It has 60 doses in there. It costs me $15. I can legally dispense that to a client for their pet, and I could sell it for $20 and make $18.50. There's no reason the American people have to pay $450 to $700 for that product, and that's a function of the pharmacies and the insurance companies. That's wrong, and that's what drives up health care where people can't afford it.
Well, that's one of the things that, as you know, one of the things that drives up health care. I want to play a piece of audio here for you.
Sure.
This is House Speaker Paul Ryan. This is Breitbart. Used to be run, of course, by the president's chief strategist, Steve Bannon. This is purportedly from an October Republican conference called by Ryan, talking about then candidate Trump. Take a listen.
There are basically two things that I want to make really clear. I am not going to defend Donald Trump. Not now, not in the future. Look, you guys know I have real concerns with our nominee.
What does that exchange say about the relationship between the party and the relationship between the White House?
Well, I think back in October, I think that spoke pretty loudly where Paul Ryan stood. I was on that conference call. I remember that conference call. I remember that remark. You know, that was Paul's choice. He chose to do that, but it's different today. I mean, he's one of President Trump's biggest proponents and supporters, and he's out there working to solve this problem of a failed health care bill that was put on us in 2009 without one Republican supporter on that. And if you remember, and this is something I think is legislative malpractice, for then Speaker Nancy Pelosi to say we have to pass it to see what's in it, we have to pass it to see how it's going to work, is legislative malpractice, and those people should not be in office. This bill, when it comes out, as you have already seen, it's been rolled out to the American people where everybody can read it, and I'll guarantee you every member on the Republican side will read this bill before we pass it.
Senator Cotton says it's dead on arrival in the upper chamber.
In its present form, when it first came out, I was not a supporter of it, but they're making reforms to it, and so it's not a finished product.
Okay, so the bill that we've seen will not be the bill that you guys vote on?
More than likely. I'm pretty much rest assured of that.
You want to give us some insight into the changes?
No, I can't do that right now. If I was good at prediction, I'd be in Las Vegas, but I'm terrible at those.
Congressman Yoho down in Florida, where I would imagine the temperature is probably in the low to mid 70s right now. Congressman, thank you.
Thank you. Appreciate you having me on. Have a great day.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.